Womb uterus cancer, also known as endometrial cancer, is a type of cancer that originates in a lining of the uterus, specifically in the endometrium. This is the most common type of cancer affecting the uterus, and it primarily affects postmenopausal women, though it can also occur in premenopausal women. Types of uterine cancer. Endometrial cancer, the most common type, originating in the inner lining endometrium of the uterus. Uterine sarcoma, the rarer form that starts in the muscle or connective tissue of the uterus, rather than the endometrium. Risk factors for uterus cancer. Several factors may increase the risk of developing uterine cancer, including age. It is more common in women over 50, particularly after menopause. Obesity. Excess body fat increases the levels of estrogen in the body, which may stimulate the growth of the endometrium and increase cancer risk. Hormonal imbalance. High levels of estrogen without enough progesterone, which can occur due to hormone replacement therapy or other conditions like polycystic ovary syndrome (PCOS), may increase the risk. Reproductive history. Never having been pregnant. Nullity. Late menopause after age 55. Early onset of menstruation before age 12. Diabetes. Women with diabetes have a higher risk of developing uterine cancer. Family history. The family history of uterine cancer, breast cancer, or colon cancer can increase the risk due to genetic mutations such as those associated with Lynch syndrome, a hereditary condition that increases the risk of several cancers, including uterine cancer. Polycystic ovary syndrome (PCOS). This hormonal disorder can increase the risk due to the imbalance in estrogen and progesterone. Previous cancer treatments. Women who have received estrogen-only hormone replacement therapy or pelvic radiation therapy are at a higher risk. Symptoms of uterus womb cancer. The symptoms of uterine cancer can vary, and some women may not experience noticeable symptoms until the cancer has progressed. Common signs and symptoms include abnormal vaginal bleeding. The most common symptom of uterine cancer is postmenopausal bleeding after menopause. Abnormal bleeding during the menstrual cycle in younger women or heavy menstrual periods. Pelvic pain, discomfort or pain in the lower abdomen or pelvis. Pain during intercourse. Some women with uterine cancer may experience pain during sex. Unexplained weight loss. This can occur in advanced stages of the disease. Fatigue, feeling unusually tired or weak. Enlarged uterus or abnormal discharge. In rare cases, the uterus may feel enlarged, and there may be unusual vaginal discharge, sometimes with a foul odor. Diagnosis of uterus cancer. If uterine cancer is suspected, several tests and procedures may be used to confirm the diagnosis. Pelvic exam. The doctor may perform a pelvic exam to check for abnormalities in the uterus or surrounding organs. Ultrasound. An endovaginal ultrasound can be used to examine the uterus and endometrial lining. The thickened endometrial lining may indicate cancer. Endometrial biopsy. A small sample of tissue is taken from the lining of the uterus to check for cancer cells. This is the most common diagnostic procedure for uterine cancer. Hysteroscopy. A procedure in which a thin, lighted tube is inserted into the uterus to directly view the uterine lining and take a biopsy. D&C dilation and curettage. If a biopsy is inconclusive, the doctor may recommend a D&C to scrape the uterine lining for more tissue. CT scan or MRI. These imaging tests are used to determine if the cancer has spread to other areas of the body. Blood tests. These tests, including a CA-125 blood test, may help evaluate the extent of the disease, though they are not definitive for uterine cancer. Staging of uterus cancer. Once diagnosed, uterine cancer is staged to determine how far it has spread. Stage 1. Cancer is confined to the uterus. Stage 2. Cancer has spread to the cervix but not outside the uterus. Stage 3. Cancer has spread to the ovaries, fallopian tubes, vagina, or nearby lymph nodes. Stage 4. Cancer has spread to distant organs such as the bladder, rectum, or other parts of the body. Treatment options for uterus cancer. Treatment for uterine cancer typically involves a combination of surgery, radiation, chemotherapy, and sometimes hormone therapy. The specific treatment plan depends on the stage of the cancer, the patient's overall health, and other individual factors. Surgery. Hysterectomy. The most common treatment for uterine cancer is a total hysterectomy, which involves the removal of the uterus and cervix. If the cancer has spread, the surgeon may also remove nearby lymph nodes, ovaries, and fallopian tubes by lateral salpingo-oophorectomy. Radiation therapy. Radiation may be used after surgery to kill any remaining cancer cells, especially if the cancer is in an advanced stage or if there is a high risk of recurrence. It can be used as the main treatment if surgery is not an option. Types of radiation include external beam radiation or brachytherapy, internal radiation. Chemotherapy. Chemotherapy may be used if the cancer has spread outside the uterus or if it has returned after initial treatment. Chemotherapy drugs used for uterine cancer include carboplatin and paclitaxel. Hormone therapy. For some types of uterine cancer, especially those that are hormone receptor positive, hormone therapy may be used to block the hormones that fuel cancer growth, such as progestins or aromatase inhibitors. Targeted therapy. In some cases, medications that target specific genetic mutations in the cancer cells may be used. Immunotherapy. Immunotherapy may be an option for certain advanced cases of uterine cancer, especially those with specific genetic mutations or if the cancer has become resistant to other treatments. Prognosis and survival. The prognosis for uterine cancer depends on the stage at diagnosis and the overall health of the individual. The earlier the cancer is detected, the better the chances for successful treatment. The survival rates for uterine cancer are generally good when it is diagnosed at an early stage. Stage 1. 5-year survival rate is around 95%. Stage 2. 5-year survival rate is around 75 to 85%. Stage 3. 5-year survival rate is around 50 to 60%. Stage 4. 5-year survival rate is around 15 to 25%. Regular follow-up care after treatment is essential for monitoring for any signs of recurrence. Prevention. While there is no guaranteed way to prevent uterine cancer, several steps can help lower the risk. Maintain the healthy weight. Since obesity is a significant risk factor, maintaining the healthy weight through diet and exercise may reduce the risk. Manage hormone levels. For women taking hormone replacement therapy, using a combination of estrogen and progesterone may lower the risk of uterine cancer compared to estrogen-only therapy. Use of birth control. Some studies suggest that using oral contraceptives, birth control pills for several years can reduce the risk of endometrial cancer. Regular gynecological check (UPS). Early detection through routine gynecological exams may help spot any issues early, especially for women at higher risk. Conclusion. Uterine wound cancer, particularly endometrial cancer, is the most common cancer of the female reproductive system. It is most common in postmenopausal women, with symptoms like abnormal vaginal bleeding being the most notable warning sign. Early diagnosis and treatment, typically involving surgery, radiation, and chemotherapy, lead to a good prognosis, particularly if the cancer is detected in its early stages. Regular monitoring and managing risk factors, such as maintaining the healthy weight and balancing hormones, can help reduce the risk of developing uterine cancer.